Hello, everyone. We're going to go ahead and get started here. Thank you for joining another Numbers with Nick live stream today. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. So as always, we're just going to talk a little bit about some of the recent data. And if you have questions, feel free to put those in the comment section below the video, and we'll try to answer those questions live on the video today. And if you are watching the recording of the video, you are more than welcome to put your questions in the comment section, and we will try to answer those questions on a future video or directly. So with that, I just want to talk about some of the most recent trends that we're seeing in COVID-19 case activity. We are seeing increases most recently in the past couple of weeks that give me a little bit of pause for concern and indicate that we may continue to see ongoing spread and increases in hospitalization and things like that related to COVID-19. So I wanted to go through and talk about some of the data that we're seeing. And so what I'm going to pull up is our Rock County and Wisconsin case information report that's linked right on our public health website. If you've watched one of these streams before, you're probably very familiar with how to access this information. So I'm going to just kind of jump right into some of the data points that are a little bit concerning to me. And the first one is the number of new cases over the last 7 days per 100,000 population. If you've been following these numbers, this number has been creeping up and up and up recently. Over the last week, I think we're almost 50% higher than the number of cases we saw in the previous week, and the week before that, there were 50% more cases. So we're seeing a pretty steady increase in the number of cases. And if you are following the CDC's kind of thresholds for kind of how they determine case spread in a community, their maximum is 100 cases per 100,000 as being kind of the high threshold. So anything above 100 is considered high case spread of COVID-19. So we're at 356 new cases per 100,000. So that's well above that 100 threshold benchmark that we're trying to reach in terms of case activity. The other number that I want to draw your attention to for the stream today is this number of active cases in the community. If you've been following along with some of the data most recently, we have seen this number increase pretty substantially over the past couple of weeks. I want to say about a week ago, or a little bit more than a week ago, we were in the 600s for our active case numbers. So it just shows you how quickly the virus can spread and how quickly we can be kind of at a level of moderate disease activity to a level of more in the range of high case activity when we look at our active case numbers. The CDC doesn't have a threshold for active case rates or active case numbers, but based on the increase, we're seeing pretty high active case numbers. Just for kind of comparison's sake, when we looked at these numbers in mid-November of last year, we were over 2,000 active cases in the community. So the good news is that we're not to the level that we saw at the peak in mid-November, but the rate of increase and the trends and the direction that we're moving is a little bit concerning. I don't want to see a similar peak to last year, this year, kind of in December or January, and that is a possibility when we see the number of cases and things like that and still see a pretty sizable chunk of our population who have yet to be vaccinated. We could see a continued increase in case activity. And right now, this data is a little bit older. This is the most recent data we have in our hospitalized patient numbers is from Tuesday. So we don't have updated data on this graphic yet, but I'll add that today. The most recent total we had was 21 patients in the hospital system getting care for COVID-19. Unfortunately, based on the reports, there could be as many as 28 patients in the hospital today getting care for COVID-19. So we are seeing an increase there in terms of our COVID-19 hospitalizations. And so what we kind of see along the course of the entire pandemic is when we have spikes in case activity, we usually see increases in hospitalized cases that kind of trail maybe 2 to 3 weeks from when the increases occur. So When you look at previous spikes in mid-November, we really started to see case activity take off kind of in the few weeks preceding this spike, where we were seeing 74 patients in the hospital system getting care for COVID-19. And although our numbers are nowhere near kind of that 70 level that we saw last year, one of the concerning things is that hospital resources are scarce right now. So based on the data that the hospital systems are reporting to the health department, they have very few medical or general surgical beds available or ICU beds available. And this isn't necessarily caused solely by COVID-19 patients, but what we've seen is that everyone who shows up to the hospital and is sick and needs to be hospitalized for chronic conditions, heart attacks, strokes, those kinds of things that regularly occur, in combination with the COVID-19 patients that need hospitalization, that really puts a strain on our healthcare resources. And so most recently, we've seen less than 10% of our beds being available. And that is a little bit concerning, because we don't want anyone to not get the care that they need or have to wait to get care because there is not beds available or they need to be transferred to a different facility. So that's another piece of data that kind of just gives us a sense of the trends that are occurring right now. And just to give you a sense of the trends over time with some of our positive results and our active cases, looking at the active case numbers, this is data that is trended on a daily basis and looks at the number of active cases in the community. So kind of between July and October, we saw an increase, and then by mid-October, we were starting to see a decrease in active cases. Unfortunately, we're starting to see those active case numbers increase pretty quickly here in the last couple of weeks. And so this kind of trend is a little bit concerning when you see a pretty drastic increase in the number of active cases. We don't want to see an increase at all, but when it is a little bit quicker than we've seen in the past, that just means that the virus is spreading pretty rapidly. So it's very important that we take those protection measures. And I'll be talking about that in a little bit here, but wanted to just cover a few more data points before moving on. So the other metric that I take a look at is the number of new cases per day, and look at the 7-day moving average. So this graph here in the middle of the page, it shows the number of new cases in red, and then the black line is the 7-day moving average. The idea behind using a 7-day moving average is trying to smooth out some of the variation that could be caused in kind of reporting lag, or other kinds of data issues that isn't necessarily reflected by what's occurring on the day in question. So the 7-day moving average tends to smooth out some of those variances. So what you can see here is basically kind of from mid-November or mid-October through today, we're seeing a pretty strong increase in the number of new cases that are being reported to the Rock County Public Health Department. So again, these are all kind of data indicators that show that the virus is spreading pretty rapidly in the community. There may be a higher risk of contracting the virus if you're out and about in public. So it's important to continue wearing your mask when you're in public spaces. Get vaccinated if at all possible. Get your booster dose if you're eligible for a booster dose, and continue practicing kind of those social distancing and other basic hygiene protection measures that will prevent you from getting COVID-19 and also other kind of seasonal viruses that tend to circulate around this time of year. So, washing your hands and covering your coughs and sneezes, those are all very important things to do. So at this point, I don't want to cover any other data on the live stream today, but I do want to switch gears a little bit and talk a little bit more about safety over the holidays. So one of the things that we've seen in the past is there can be surges in case activity when we're around holiday seasons. We saw this last year around the July 4th holiday, where people were getting together, and we saw increased reports of case activity and spread within kind of parties and gatherings where people are getting together. We have seen some anecdotes about Halloween this year and sleepovers and get-togethers and parties and things that resulted in increase in case activity and people unfortunately catching COVID-19 at these events. And so I think it's very important as we move into the holiday season to really think about the precautionary measures that can help you prevent spread within your family gatherings, prevent spread from those who are vulnerable in your family, and protect your family members from COVID-19. So the state of Wisconsin has a nice piece of information on staying safe in your community and specifically over the holidays. So I just wanted to kind of reiterate some of this information that many of you are probably well aware of and practicing already. But for those of you who are kind of curious about what you can do over the holidays to keep, keep the party happening, but also keep the parties safe and keeping people protected, I think the first thing is really it's important to get vaccinated. So what we've seen in Rock County and Wisconsin and nationally is those who are vaccinated are much more likely to not get COVID-19 or are much less likely to get COVID-19. They're also much less likely to have to be hospitalized if they do end up getting COVID-19 and much less likely to die if they get COVID-19. So we're seeing really high protection levels among those who are fully vaccinated, especially from severe illness with respect to COVID-19. The other thing is if people are not vaccinated, it's important to wear a mask in these family gatherings. If people are vaccinated and they're wearing masks, that's an extra layer of protection. We have seen case spread among people who are vaccinated. There's been about 900 cases among those who are fully vaccinated out of the 20,000 plus total cases over the course of the pandemic. So it's a small number when we compare it relative to the scale of the pandemic, but it still does happen. So getting vaccinated and wearing a mask is very important. Additionally, if you can maintain 6 feet of distance at your gatherings, I know that sometimes isn't a reality, but that distancing will help prevent the spread. We've seen higher rates of spread when people are in closer proximity. So it's just very important to practice good hand hygiene, so washing your hands frequently. And like I said, that prevents a number of different illnesses, not just COVID-19, but your seasonal viruses and things like that. So that's a very good kind of protection layer to add into your holiday gatherings. Also, if you're feeling any kind of symptoms, it's important to get tested and stay home. So unfortunately, if you get to Wednesday next week and you're starting to feel sick, you should probably go get tested and avoid going to those family gatherings just to play it safe and not expose your family members to a potential virus like COVID-19. And if you do find out that at one of your gatherings you were a close contact, it's important to get tested as well, just to make sure that if you do have COVID-19, that you isolate appropriately and make sure that you're well aware of the situation and how to protect yourself and your family members from further ongoing spread of the disease. So some other kind of very specific pieces of recommendation and guidance are captured here on the page, and we can always post a link to this information. But really, I think right now what we're doing or what we're seeing in the community based on COVID-19 spread is a little bit concerning. So I want to make sure people are aware of the trends before they are getting together with family members over the holidays. And the best protection right now is getting vaccinated. If you have questions about the vaccine, the safety or the effectiveness of the vaccine, you can talk to your provider. It's really important to have those conversations with your healthcare provider if you do have those concerns. If you have questions about the vaccine and want some more information, you can go to rockcountyshot.com. This website has information on the vaccine in terms of safety and effectiveness. It also has information on where you can get vaccinated. Right now, I'm just going to show a little bit more information about our Rock County Public Health Department's vaccine clinic. We have a vaccine clinic currently happening at the Rock County Public Health Department, and I'm just pulling the information onto the screen here. But every Wednesday from 3 to 7 p.m., we will be having a COVID-19 vaccine clinic at the health department. So you can access this this information, go to co.rock.wi.us/public health, and then navigate to the COVID-19 page and the vaccine link. But from 3 to 7 every Wednesday, we'll be hosting a vaccine clinic. And we do have the vaccine for children. So everyone ages 5 and older are welcome. And we do require parental consent for anyone who shows up under the age of 18. And we do need a parent or guardian accompanying anyone who is under the age of 11. So we will provide booster doses. We'll also provide vaccines for those children. And the vaccine is free for anyone who shows up. Walk-ins are welcome, but you can also call this number on your screen to get an appointment, or you can access this link right here to sign up for an appointment. So with that, I'm just going to check the chat box to see if we have any questions. All right, looks like no questions. So we're going to close the stream for today. But I thank you for joining me and taking a look at some of the data and the precautions over the holidays. I hope everyone has a happy and healthy Thanksgiving and has safe holidays moving forward. And we will talk to you in a couple weeks.